Your humerus. Okay. So how do you know superior and inferior? So wherever is the head, that's the superior. So of course, opposite in the inferior, clear. Okay. Where's medial and lateral? Okay. So wherever is the humeral head is facing, that will be the medial. So if we siya towards there, so this would be the medial side, lateral siya. Here. Okay. Where's anterior, where's posterior? Where is anterior posterior? Okay, so wherever is your lesser tubercle, so expect that's more than anterior. Or here, if you can see two fossa here, two fossae, anterior na siya. Posteriorly, you only have one fossa. So posteriorly. Now, okay, let's discuss now the parts. Okay. So first, you have this, your humeral head or head of the humerus. Okay, the lateral to the head of the humerus, you have the anatomical neck of the humerus. The anatomical neck. Okay, lateral to the neck, you now have the greater tuberosity. So here, this tuberosity is greater in size, more laterally located and more superior, so you have your greater tuberosity or greater tubercle. The other tubercle is found a little bit lower and more medial and lesser in size than this one. So this is now your lesser tuberosity or lesser tubercle. Okay. Between the two tubercles, the presence of a groove, so we call that groove known as your bicipital groove, or some other call this our intertubercular groove. It's inter between the tubercles. So this one. Okay. Below the tuberosity tubercle, narrow portion, this will be considered as the surgical neck of the humerus. The surgical neck, because this is where usually we can encounter a fracture and they would undergo that surgical procedure. So mention the surgical neck of the humerus. And below you have the shaft of the humerus. Okay, so the shaft of the humerus, and posteriorly, kanina part, posteriorly you have one part and a presence of a groove where your radial nerve passes through. So we call this groove as the spiral groove or your radial groove. Show where your radial nerve passes through. So you have your spiral groove or your radial groove. Okay, we're going to look at the bone a little bit on the lateral side line where pupulot niya, roughen siya. So that will now be your deltoid tuberosity. Your deltoid tuberosity where your deltoid muscle would insert. Okay. So moving further below, this one, we call this part now as your supracondylar bridge. So one on the medial side, we call that now your medial supracondylar bridge. One on the lateral, you have this lateral supracondylar bridge. So medial supracondylar bridge, lateral supracondylar bridge. Okay. Below to this supracondylar bridge, at this side here, so on the extreme sides, you have this one because your epicondyles of the humerus. This one. So you have on the medial side, you call it your medial epicondyle. The lateral side, you have the lateral epicondyle. Medial lateral epicondyle. Okay. Further below, you have these two bony parts. Okay, one you have this on the medial side. This is the shape there looks like an hourglass, or the hourglass time. So this is now your trochlea. So you have your trochlea. Then the lateral and the rounded, you have your capitulum. Right. So above this trochlea and capitulum, there are presence of fossae anteriorly. So sa anteriorly, you you have two fossae. Above the trochlea, right, blood pressure there, that would now be your coronoid fossa. The coronoid fossa, when you flex or bend the elbow, will go inside yung coronoid process sa una. Lateral to this coronoid is found above the capitulum. You have this your radial fossa. So the radial fossa, when you bend your elbow, this is where the head of the radius would get in. Okay. Then posteriorly you have one fossa, posteriorly, and we call that fossa known as the olecranon fossa. Olecranon fossa. So this is where your olecranon process will go inside when you extend the elbow. Okay? So here.